So today I'm going to be teaching you about rheumatoid arthritis, also known as RA. So let's begin with what is rheumatoid arthritis. RA is an autoimmune disease that causes painful, stiff, and swollen joints. Rheumatoid arthritis is, again, considered an autoimmune disease, but what is an autoimmune disease? This is a disease in which your body's immune system is hyperreactive, causing it to attack itself. This means it attacks its own cells, tissues, and organs, even if they're healthy. But RA is different than osteoarthritis because osteoarthritis is caused by mechanical wear and tear of the joints, while rheumatoid arthritis is autoimmune. Rheumatoid arthritis is a protein that is found in the synovial lining of the joints. So, right through here. And it's a thin layer of connective tissue. So, where the body is attacking the RA protein, it causes more synovial fluid to be released, causing the joint to swell and causes it to create more synovial fluid and creates a lot of pressure and inflammation in that joint. So, in this little picture I have over here, you can see the difference between osteoarthritis and rheumatoid arthritis. So, this is what a normal joint should look like. So, you see the synovial fluid, the cartilage, the tendon, everything's where it should be. And then in osteoarthritis, the cartilage kind of wears away, and that's what causes the joint pain. But in rheumatoid arthritis, the synovial membrane ends up inflamed and swollen because of all the synovial fluid being released. But the exact reason isn't really known, like what causes RA. It's believed that it's genetic and that your hormones and environmental factors play a role in why you can get it. So some of the environmental factors include smoking, infections like viral, bacterial, anything like that, and other pollutants. So, even if it's like secondhand smoke or if you live in an area that has a high pollution rate. Women are also more likely to get RA because of their hormones. This includes pregnant women. A lot of pregnant women can get RA while they're pregnant, and it can go away after they give birth and their hormones go back to normal. It's also said that RA, like genetically, can stay in your body and can basically pop up and be inflamed whenever you are exposed to these certain factors. So you can carry it. So what happens when you have rheumatoid arthritis? So as I stated before, it affects your synovial lining. So when the synovial lining begins to make more fluid, the fluid gets thicker and begins to push on the joints, and that starts to destroy the cartilage and bone, which, causes all the pain and inflammation. The muscles, ligaments, and tendons can't support the changing shape of the bones and how swollen it is on the inside, so they tend to become more and more weak and can't handle the same stress as they could before. This is what causes the joints to become misshaped, as you see in, one of the pictures in the past. Some of the symptoms that you can experience when you have RA is joint pain, stiffness, swelling of the joints. You can get a low-grade fever, experience weight loss, have difficulty moving because your joints are inflamed, chest pain, and loss of energy and fatigue. Some of the body systems that it affects include skin. So skin, RA can cause rheumatoid nodules, which are small lumps under the skin over bony areas. The eyes, RA can cause dryness, pain, inflammation, redness, sensitivity to light, and trouble seeing properly. In the lungs, rheumatoid arthritis can cause inflammation and scarring in the lungs, which can lead to shortness of breath and lung disease. The heart, RA can damage the heart muscles in the surrounding areas and makes you more likely to have a heart attack. It can also affect the nervous system because the inflamed joints may affect the sending and receiving of messages from the central nervous system, and the rheumatoid nodules can also cause cord compressions, which are extremely dangerous. Of course, it affects the joints, the synovial lining in your joints, but it can also affect your blood because it can make you anemic, which just means you have a shortage of red blood cells. And it affects your muscles because it weakens, or weakness is commonly reported by patients with rheumatoid arthritis, so it makes your muscles like lose mass. This is a picture of a rash you can get that's pretty common with rheumatoid arthritis, and these are the most affected areas that you get arthritis in. It's also a disease that affects you symmetrically, so if you have arthritis in one of your hands, then you probably have it in your other hand also, because it tends to attack both sides. And these are my citations.